This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the Journal of Hospital Infection, published in 2026.
This is a paper that I think every resident and attending needs to have on their radar. It's titled, Association Between Duration of Neurosurgical Craniotomy and Surgical Site Infection, a Prospective Cohort Study. Now, Ilara, we've always had this intuitive sense that the longer we're in the OR, the higher the risk for the patient. But this study tries to move beyond intuition, doesn't it?
Exactly, Dr. Aris. The researchers set out with a very specific goal: to quantify the dose-response relationship between the duration of neurosurgical craniotomy and the risk of surgical site infection, or SSI.
That term dose-response is critical here. In pharmacology, we talk about dose-response in terms of medication, but applying it to surgical time is a powerful way to look at surgical trauma and environmental exposure.
It really is. By treating the duration of craniotomy as the dose, the study provides high-level evidence that can help us optimize our perioperative infection prevention strategies. Unlike many previous studies on this topic, which were often retrospective and prone to cherry-picking data from old charts, this was a prospective cohort study.
And for our residents listening, that's a key distinction. Prospective data collection means they were tracking these variables in real time, which significantly reduces bias and allows for a much more accurate quantification of that SSI risk. When you're looking at something as multifactorial as a surgical site infection, you need that level of rigor.
Definitely. The study specifically focuses on the neurosurgical craniotomy, which we know is a unique environment. We're dealing with the blood-brain barrier, often using implants like plates or mesh, and sometimes dealing with long operative times for complex tumor resections or vascular cases.
Right, and when the paper talks about optimizing perioperative infection prevention strategies, it's really asking us to look at the clock. If there is a clear dose-response relationship, then time is not just a logistical factor, it's a modifiable risk factor.
That's a great point. If we know that the risk of SSI increases significantly after a certain dose of time, it changes how we approach the entire surgical workflow. It might influence how we handle surgical breaks, how we schedule resident teaching during a case, or even when we decide to redose prophylactic antibiotics.
I'm interested in how this high-level evidence might change our pre-flight checklists. If the data shows a sharp uptick in infection risk after, say, the 4-hour or 6-hour mark, should we be more aggressive with irrigation or change our gloving protocols more frequently?
The study suggests that this data is exactly what we need to provide that high-level evidence for our protocols. Instead of just saying, try to be efficient, we can now say the duration of the craniotomy is directly associated with a quantified increase in SSI risk, which makes efficiency a matter of patient safety rather than just OR management.
It also puts a spotlight on the neurosurgical craniotomy as a specific procedure class. We can't necessarily generalize data from orthopedic or general surgery to the brain. The tissue handling and the duration involved in a complex skull-based case are entirely different.
Precisely. And by focusing specifically on craniotomies, the study gives us a more tailored understanding of our specific patient population. For the medical students listening, this is a reminder that every minute the wound is open, the dose of exposure is increasing.
It's a call to action for surgical discipline. Every movement in the OR should be purposeful. Ilara, what do you think the biggest takeaway is for the research community based on this 2026 paper?
I think it's the shift toward quantifying risk. We are moving away from long cases are risky toward a precise understanding of the association between time and infection. This allows us to create better evidence-based perioperative strategies.
Well said. Efficiency in the neurosurgical suite isn't about rushing. It's about reducing the dose of time to mitigate the risk of SSI. This prospective cohort study provides the high-level evidence we've been waiting for to really back that up.
It's a vital piece of literature for anyone looking to optimize their outcomes.
That's all the time we have for today's episode. Thank you for joining us on the Neurosurgery Hub podcast.
We'll see you next time.